Hello, welcome back to Neonatal Clinical Series.
Today we are going to discuss the use of Milrinone in the ICU. We will go through different points to be able to use Milrinone effectively with minimum side effects.
The outline of this video. We will go through the pharmacology of cyclic AMP receptors and how it works. Milrinone mechanism of action. Milrinone indications. Drawbacks of Milrinone use. Special considerations while using Milrinone. Dose of Milrinone in neonates.
So without any delay, let's start with the first point, which was cyclic AMP receptors and how do they work. As we all know, the heart can have beta receptors, which is very important for the contractility of the muscle. We are going to discuss the pharmacology of these receptors. These receptors binds with beta-1 agonist, and when this acquire, they produce adenyl cyclase. Adenyl cyclase stimulates the formation of cyclic AMP from ATP, which in turn activates the cyclic AMP-dependent protein kinase, for short, pKa. pKa are the phosphorylating enzymes that are responsible for the opening of calcium channels so the calcium can enter into the cardiac muscle. And whenever an impulse reaches to the cardiac muscle, it produces an increased force of contractility, which is very good for the heart. However, unfortunately, the cyclic AMP action can be determined and can be metabolized to cyclic AMP through BDE3 phosphodiesterase 3 enzyme, which are selective for the cardiac muscle. When this occurs, there will be no formation of pKa, protein kinase A, which in turn inactivates the calcium channels opening, so the contractility of the heart will be decreased. Drugs like Milrinone, which are classified as phosphodiesterase 3 inhibitors, will inhibit phosphodiesterase 3 enzyme, which in turn will inhibit the metabolism of cyclic AMP into AMP, and this will cause the presence of cyclic AMP for a longer duration and the production of pKa and the opening of calcium channel blocker. That's why Milrinone is considered as a drug that causes and increases the contractility of the heart.
So, as we saw, Milrinone is a phosphodiesterase inhibitor with inotropic activity. We discussed the pharmacology and saw that it is not dependent on neurotransmitter receptors. So the action of Milrinone in the body is to increase cardiac output, decrease pulmonary resistance without a significant increase in oxygen demand. So after we discussed Milrinone mechanism of action, we can easily predict its indication in NICU. Since it works mainly as an inotropic with decreased pulmonary pressure, it can be used in pulmonary hypertension. Also, due to its inotropic effect, it is used to reduce afterload in neonates with congenital heart disease with low cardiac output syndrome after surgery. Though Milrinone carries a lot of benefits, yet there are some drawbacks that we have to keep in consideration while using Milrinone, and these drawbacks are: its slow onset of action, as Milrinone takes hours to work, so don't expect a fast response. Since it works on contractility, it may cause arrhythmias and tachycardia, so we have to monitor the heart while using Milrinone. Hypotension. It may cause severe hypotension, especially in neonates, so blood pressure must be monitored, and don't start Milrinone in hypotensive patients. Thrombocytopenia. So in patient with bleeding or sepsis, Milrinone must be used with caution. Special considerations to be taken while using Milrinone to get the best benefit from it with minimum adverse effects. First, As we mentioned, Milrinone can cause hypotension, so it cannot be used in extremely preterm infants and in hypotensive patients. Also, you need to monitor blood pressure while using Milrinone. For the same reason, it is recommended to avoid loading doses in neonates. Avoid using Milrinone in severe obstructive aortic disease, as Milrinone works on the heart, increasing its contractility, so it cannot be used in aortic obstructive disease. Milrinone is mainly excreted renally, so it cannot be used in oliguric patients or anuric patients, as Milrinone will not be eliminated in these patients and toxicity may occur. After discussing the use and drawbacks of Milrinone, now we come to the dose of Milrinone in neonates. Recommended starting dose is 0.375 micrograms per kilogram per minute. No loading dose necessary, and range is 0.375 to 0.75 mcg/kg/min. We start with the lowest possible dose. You can titrate the dose with respect to the clinical response and its effect on blood pressure. As we mentioned before, no need to give a loading dose in neonates to avoid the risk of arrhythmias and hypotension.
Since Milrinone is used as an infusion, it is important to know that when diluted to a concentration of 0.2 milligrams per milliliter, it is stable and can be used for 72 hours. We came to the end of our video. Hope you enjoyed watching it. Don't forget to subscribe to get to see all our videos.